Hello, my name is Steve Allen, and I would like to review with you the lumbar back muscles. Credit to references and the research and work done by Lance Toomey, Neil Bogduck, and James Taylor in their publications, Clinical Anatomy of the Lumbar Spine, as well as Physical Therapy of the Low Back, and Gray's Anatomy as my references today. So we're looking at the aponeurosis, erector spinae aponeurosis, as it comes into the lower lumbar spine. The aponeurosis is made up of two muscles, as you recall, the longissimus thoracis and the iliocostalis, merged to form this broad sheet of collagen called the aponeurosis as it comes over the lower lumbar spine and attaches into the sacrum and iliac crest. To appreciate on this shot, there is the multifidus. Note the bulk of the multifidus from Gray's Anatomy represented here, thinning as it becomes more thoracic in its origin. So a refreshing way, I think, to look at the paraspinal muscles coming off this aponeurosis is think of origin, more cephalad, and come down. And in fact, these are tendinous in their origin off the ribs, both the longissimus and the iliocostalis. They become muscular and then become tendinous again as they approach the lower lumbar spine. So the longissimus thoracis and the iliocostalis actually only constitute 1/2 of the lumbar back muscles. The longissimus thoracis has a second division dedicated only to the lumbar spine, and it is beneath the aponeurosis. But because it is intimate in its orientation to the longissimus, it is referred to as the longissimus thoracis pars lumborum. So we're going to look at that muscle, which cannot be seen as long as the aponeurosis is here. So the nomenclature for the iliocostalis thoracis will become, the iliocostalis lumborum is its proper name. When you're referencing the deeper fibers, which again cannot be seen here, it will be the iliocostalis lumborum pars lumborum. Sounds redundant, but if you wanted to speak about the iliocostalis in the thoracic region, it will be the iliocostalis lumborum pars thoracis. It is perhaps a little redundant, but I think in grasping the nomenclature, it helps to arrive at the proper anatomical level in our descriptions. So let's remove the aponeurosis and go to a schematic on the spine and study the deeper fibers. So I've made a little model here with some pipe cleaner and the spine and a few holes that have been drilled so we can get as best I can the placement, origin, insertion of these deeper fibers. So let's begin on the largest and the most medial group, the multifidi. This anatomy has perplexed me in terms of origin insertion for some time, and so it's fun to go back and revisit and actually break it out segmentally. So if we take any one of these lumbar vertebrae, and I happen to take L3, and we follow the anatomical description as brought forward by the mentioned authors, then we will anchor off the spinous process of L3 and proceed caudolaterally with these different fascicles. Now, not shown, and I'll just go over to the right of the L3 segment. On this lamina, there is also a multifidi that comes off the dorsolateral surface of the lamina and will cross L4 and insert into the mammillary process of L5. So it crosses this vertebrae to attach onto the mammillary process about here. that's not shown, and those are called the laminar fibers. They are deeper. And those deeper fibers oftentimes will attach not just to the mammillary process, but actually into the joint capsule. And the purpose of that is to prevent the joint capsule from becoming impinged during the gliding movements of the zeg joints in bending forward and backward. By far, the largest portion of the multifidi come off the spinous process at each level in a series of fascicles. And there is a consistent pattern, although not exactly locating caudally in the same location, the pattern remains the same. There will be a primary fascicle or two that is dedicated to the mammillary process 2 levels below. So for L3, it will insert into the mammillary process of L5, and it will, via what they call the common tendon of the multifidus, from this spinous process, those fascicles will run to the sacrum. At an L3, they will attach at about this level, about the 2nd to 3rd sacral level, into the sacrum. Now this pattern is going to be repeating at each lumbar level. So L4 and L5 will become more medial. If we started up at L1, we would see more attachment into the lateral portion of the sacrum. It would be consistent to call this arrangement one of segmental control or action. First of all, we have the bundling of fibers at each spinous process, and these are large spinous processes, as you recall, so there is distinct mechanical advantage to anchor onto the spinous process. And there is segmental consideration by the nerve. So the posterior primary ramus, which I brought out of the intervertebral foramen at L3-4, to wind back around and innervate the multifidus at this level, that neurology and this arrangement of the fascicles off the vertebrae strongly suggests segmental control at each lumbar level. Now, if you go back and think about the aponeurosis, it is on top of this. It is independent of this. The aponeurosis does not have direct anatomical attachment into these deeper fibers of the lumbar spine. So the suggestion of that would be independent action and movement of these lumbar vertebrae beneath the aponeurosis. Let's consider the vectors of the multifidus now. Obviously, from this orientation, quite vertical. And towards the end of this presentation, we'll turn the spine laterally so we can appreciate the vectors and the contrast between multifidus and the more outlying lateral, deeper muscles of the lumbar spine as well. Nonetheless, if I tug on my common tendon fascicles that are coming off L3, the effect would be one of posterior rotation. So the spinous process dropping low, the vertebral body anteriorly will rise up, and there will be a extension moment of L3 on 4. So obviously the multifidi with these fascicles are strong posterior sagittal rotators of the lumbar spine segmentally. Additionally, because of this fairly vertical orientation, there is a large compression vector as well. For example, if one is holding weight out in front, carrying some substantial weight, that weight is an increase in compressive load on the spine, but it is also a compressive load that is going to be magnified when these muscles contract to maintain the lordosis of the lumbar spine. So there is a concomitant increase in compression on the zeg joints and the posterior portion of the disc and vertebral end plate when that load is being carried. This will have some ramifications when we look at how low back injuries occur related to the position of the lumbar spine. Let's move now to the next most lateral structure, and here the pipe cleaner is going to represent the longissimus. I'm going to move the iliocostalis over just a little bit to reflect the origin and insertion of the longissimus. Now, mind you, there is one at each level. So these fibers come off L5, which is the deepest, and it will come off the transverse process of L5 and attach directly into the deeper aspect of the posterior superior iliac spine in this fashion. This happens to be coming off L4, so it will be just on top of, just a bit over the top of the deeper fibers at L5. And that is the arrangement that will persist. So L3 and L2, their orientation will be more stacking, more on top of the fascicles beneath it. So this fiber orientation lends itself to a thickening of the longissimus tendon, the longissimus thoracis pars lumborum. There, I said it. And this common tendon actually becomes the lumbar intermuscular aponeurosis. So the intermuscular aponeurosis is actually made up of the longissimus tendons in their descent to the medial aspect of the posterior superior iliac spine. In our surface anatomy, we can appreciate with thumb palpation just inside the PSIS and asking our patient to set their inner core, being cautious not to engage the glutes and the abdominal muscles, but simply igniting the pelvic floor and monitoring the rise in pressure and the turgor of this muscle group in a healthy lumbar spine. So you'll actually feel these fibers contracting, both the iliocostalis that we'll talk about in a moment and the longissimus. From this orientation, again, becomes more obvious when we look at a lateral view. We're going from the more vertical vector of the multifidus now to a more frontal direction. So we have lowered ourselves down to be more horizontal in this fashion when we look at these more lateral structures, lateral muscles of the lumbar spine. And the significance of that is that not only will this muscle group contribute to posterior rotation of the lumbar spine, but particularly at L4 and L5, the more horizontal orientation will lend itself well to posterior translation. So let's take a hold of longissimus fibers and pull. And now instead of, at this orientation, instead of the spinous process dropping down, we're literally pulling the vertebrae backwards, creating posterior shear. And it is said that when looking at the longissimus, the lower fibers are going to contribute more to posterior translation. As we ascend in the longissimus orientation, it will contribute more to posterior rotation. Obviously can't do those separately, so part of those vectors are part of each fascicle's arrangement and function. But there will be a dominance of one versus the other depending on what level we're at. And then just moving our pipe cleaners back into place here. Now let's look at the red pipe cleaners representing the iliocostalis lumborum, pars lumborum. So these fascicles are going to come off the transverse process as well as 2 to 3 centimeters into the middle layer of the thoracolumbar fascia. So the attachment is not only to the more lateral tip of the transverse process, but also into the fascia itself, the thoracolumbar fascia. And the iliocostalis will then run in a same fascicular arrangement. So you're going to see at each level